Hi, today I'm going to show you how I perform prolotherapy of the ankle. This patient has sprained his ankle multiple times and has a loose and painful ankle on the outside and on the inside. These ligaments have been injured. Most common anterior talofibular ligament, or ATFL, has been injured. Also the deltoid ligament has been injured. So what we're going to do, we're going to do prolotherapy with dextrose into these ligaments and into the joint, and the prolotherapy will stimulate a healing response. Basically, when we inject the dextrose into those ligaments, the ligaments swell up and then they get stronger and tougher, and that will give stability to the ankle and will decrease the pain and improve function. All right, first I'm just going to mark all my landmarks. I'm using the ultrasound to identify all the important structures like the ligaments and the tendons. And this will allow me to make sure that the procedure is done accurately. I'm going to clean the area with a sterilizing solution. This is chlorhexidine with some alcohol, and what it does, it makes the skin completely sterile and makes it ready for the procedure. I'm going to numb up the area before the injection. Basically put a little bit of lidocaine into the skin and just underneath the skin, and that's going to make sure that the injection is well tolerated. All right, we're going to go ahead and start with the prolotherapy. I'm going to inject the calcaneofibular ligament first. That's one of the ligaments that supports the outer part of the ankle and gives it stability. And that's when it's commonly sprained as well. You can see my needle approaching the bone right there, and that's where the ankle, or that's where the ligament inserts. I'm going to do some of the posterior ligaments as well. You can see the needle approaching the bone, and there it is. Now I'm going to treat the anterior talofibular ligament. That's the ligament that's most commonly sprained in most people when they sprain their lateral ankle. It's the one that supports the outside of the ankle, and it's a very important ligament in maintaining function and stability. So we're going to go ahead and inject. You can see my needle going towards the bone, and here we are injecting. Perfect. So I'm going to inject it right at its origin, where it comes off the bone. And then we're going to inject it also right where it inserts into the talus. Now we're going to inject the ankle joint. It's an important injection to make sure that the joint that's supporting the ankle is functioning pretty well. You can see my needle into the joint, and you can see the fluid spreading into the joint. Okay, now we're going to treat the inner part of the ankle, the medial ankle. That's where the deltoid ligament supports the inner part of the ankle. All right, we're done with the ankle prolotherapy procedure. All the ligaments have been injected around his ankles. Also, we injected the joint. So now he's going to go home and he's going to go through a healing process. Over the next 2-3 weeks, this ankle is going to get a little bit inflamed, and it's going to start getting stronger and stronger. And his pain should go away pretty quickly, and his function should improve as well.